The original nursing program was an associate degree program, and that was started in the early 80s, late 1970s even, possibly. And then it transitioned over to a bachelor's degree program in the late 1990s.
It's a total right now of roughly 127 credits, and we are dropping that back just a little to about 124, 125 in the next few semesters. So it's a 6-semester program over the course of 2 years, so it is full-time.
Ferris's nursing program really is preparing me for what realistically nursing is like in the real world.
Prior to coming into the bachelor's degree program, the students are required to take a number of prerequisite courses in their general education courses.
We ease them into it where nothing goes wrong and they get to experience that, and then we'll add some complications.
Well, we have 2 laboratories that the students spend quite a bit of time in. The first one is the skills laboratory up on the 4th floor of VFS. The students spend a considerable amount of time there, especially in their very first semester, learning the basic skills that they need to care for patients.
We have a wonderful simulation lab, and it allows the students to safely practice patient care in a non-threatening environment, maybe with just their students, their peers, as well as their instructors, people who they're very familiar with. And we have the opportunity to go through a variety of scenarios, which in the clinical setting, they may only run into once or twice or not at all.
Simulation lab made difference, how I would feel, how I would approach my patients on the real world.
The simulation lab, I think, is a really nice place. They spend a lot of time here, and this is what ties together what they learn in their classes. Then they come here and they practice it, and they practice it in a safe environment where they can just dive in and experience it without worrying about somebody actually getting hurt.
I feel that a lot of the equipment we learned in skills lab and sim lab were very similar to what was out in the hospital setting. We were definitely familiarized with the equipment that we learned here and practiced in the lab when we went out, which helped a lot because that stuff can be foreign if you've never seen it before.
So the classes, at first it doesn't seem like it, but they do a good job of pulling from each other, so you really see how everything connects.
I believe because of the instructors, the ways they teach helped me to succeed at the same time, being very organized, stay on top of my assignments on time and make sure I pass the course.
Students get a variety of professors. They get to see how many different nurses would handle themselves in the professional role. They also have instructors that are not only bedside nurses, but they might have a nurse practitioner. So they get to see the different roles that nurses take out in the community.
All the faculty is really helpful. They're really engaged in their students. If there's ever a point where you feel like you're falling behind, the faculty is more than willing to sit down with you.
They can talk to them, approach them, ask them questions.
I get to be here with the students when they get their first experiences with things. They get to practice. And then they go out to clinical, and then they come back and they talk to me about how what they learned here affected them in the clinical setting. And they also bring questions. They come back and they say, hey, this is what happened in clinical. What do you think about that?
We have such a diverse student population. It's really interesting. We have males and females. We have several different ethnicities. We have a variety of age groups, which I think is wonderful because it brings such a rich environment to the learning.
The reason I chose Ferris State University is diversity. Diversity not only in culture, in nationality, it's diversity in age, sex, occupation. So far, I love it.
I've had a couple experiences with older nurses who were more towards that mindset that it was a female-driven profession, and that was kind of weird to deal with that. But if you're competent, then they understand that it's really anyone can do it.
We are increasing our diversity within the nursing program. We keep track of that, but we certainly would like to increase that even more. We're very welcoming here at Ferris. I think anybody applying and coming into the program will see that we work really hard to help everyone be successful.
Many of our students do wind up being employed by one of our clinical sites. So by helping them into the clinical arena and helping them develop those relationships, then they are able to choose employment at some pretty prestigious places.
A lot of hospitals around the area know Ferris students to have that extra experience.
We know that the area hospitals really enjoy hiring Ferris students because they've seen them through their clinical experience and they've seen the quality of work that the students do.